I'm April Brooks, and this is Tulsa Talks. The global pandemic is affecting every aspect of our lives. We're all facing a wide range of permissible options, some of which are still high risk, confusing public health messaging, and competing ethical, emotional, and financial needs. Kristi, Eaton, and our guests are here to help you cut through the noise and make those everyday decisions a little easier.
Tulsa County reported its first COVID-19 case on March 6th. Less than a week later, the World Health Organization declared the coronavirus a pandemic, reaching areas throughout the world. Locally, health officials with the county, Oklahoma State University Tulsa, and the University of Oklahoma Tulsa have set up testing sites along with other clinics. Oklahoma Governor Kevin Stitt was the first governor to test positive for COVID-19 in the United States.
Yeah, I was pretty shocked that I was the first governor to get it.
There is now a mask ordinance in the city of Tulsa requiring residents to wear protective face coverings while outside the home. As of August 9th, there are more than 5 million cases in the United States and more than 161,000 deaths. In Tulsa County, there have been more than 10,000 cases and 107 deaths. Here, we speak with local health officials about COVID-19 and its effect locally. Our panelists are Dr. Bruce Dart from the Tulsa City County Health Department, OU Physicians Tulsa Chief Medical Officer Dr. Peter Aran, and OSU Center for Health Sciences Chief Operating Officer Dr. Johnny Stevens.
We could talk from the world level down to the country level, down to the state level, and then finally down to the community level, which is a question, I get it. But I think anybody who has been watching television since March, and like Johnny talked about, has consumed much of our lives for the last 4 or 5 months. We know what's happened in China. We know what's happened in Italy. We hoped that would never happen in the United States. And then along came Seattle, New York, New Orleans, Detroit, and others. But our state, we were blessed and we were protected. Things weren't really happening in our state. And then when we did our stay-at-home initiative in April and May, that seemed to really work and seemed to really be protective. When we tried to open up again, like communities across the country have done and states across the country have done, what we found out, it doesn't surprise anybody on this panel, but what all our communities found out is, as cooped up and tired of quarantine as we all were, the virus wasn't tired of that. The virus is still out there, was still out there. And educators like Dr. Stevens and myself, and you'll hear from Dr. Dart, we're all teachers. And I guess we didn't do as good a job as we should have done at helping the community understand that the virus is still out there. We're going to reopen. And there are safer things that we can do to reopen safely. And I think a mistake that we made, and not just our community, umpteen communities around the country made, is we were so tired of being at home that we just wanted to come back to normal. And the mistake there is we're not ever going to go back to normal, probably. What we are going to do is figure out as a community how to reach a new normal. And so Stevens and Aran and Dart and others, we didn't message things to our community well enough, I guess, to help people find a safe way to hit a new normal.
I completely agree with you. And when you look at the reopening, it's the reopening, but it's more of all of us. To your point, I want to emphasize this: it's all of us being cooped up and wanting to get back out. We can reopen, but we need to do it in a the most responsible way that we can. And I know we'll get more into that as we go forward. But, drilling down a little bit more into Tulsa in particular and the demographics that are here, what are the rates? And I went back and, took a look at some things. It's been on my mind and we've kind of been following it, but, positive cases in Tulsa, Tulsa County, 30% white, 24% Hispanic, 19% are Asian, 16% are unknown. In the beginning of this, we didn't collect a lot. We're got more data now than we did in the beginning, but Native Americans represent 2.3%, Black 6%, and mixed race 2.6%. Just to throw some numbers out there of the positive rates that we've had in Tulsa County, what it looks like. Now, while the percent positive is there, the deaths are still predominantly in whites. It's 72% in whites is what I have found, and this data is from July 13th, so it's fairly recent.
The one good thing about you can say it's a good thing about pandemic is that it's made us even more connected in public health and on both a personal and professional level, and I think that's going to serve the citizens of Tulsa and Oklahoma much better down the road. And frankly, as we come together and see that the issues in our community and our state are all of our issues, and even from our own place, we all have a responsibility to come together and work on these issues, especially those issues that affect our most vulnerable and our highest risk populations. And I don't just mean high risk for COVID. I mean just facing barriers and challenges to life. And if we can do that, we've shown that we can do this collectively in this response. If we can get that collectively to impact racism and social justice and health disparities, just think how much better off we're going to be. And I think we have the relationships and the cachet and the connectedness now to actually do that. So I'm excited to move on from COVID and get on to that important work. And, eventually we're going to be able to, not now, not today, and not in the next few weeks, but eventually we will be there.
One thing that I've learned, well, there's two big things I've learned in this pandemic is, one, as soon as you think you're right, you're wrong 10 minutes later. But two, just that the COVID doesn't go away when it gets hot. That was, you remember back to March where all think, man, when it heats up, well, it's heated up.
Another thing that is fundamental about this COVID outbreak, Dr. Stevens, to add to your two rules that you're following, the third rule that I think we should follow is, and believe, is, and I'm not just saying this because it sounds cute. In fact, it doesn't sound cute. It sounds ugly, maybe. It sounds bad. But there's actually more we don't know about this 5-month-old virus than we do know. And I tell people, as often as I can tell people, be wary of any doctor or scientist or policymaker or governmental leader who thinks that they have all the answers or are certain about what's going to happen. Because as Dr. Stevens said, whether it's 10 minutes or 10 hours or 10 days, there are huge changes.
I think we're doing the best that we can possibly do. This is something that's novel, that's new, that we train for these kind of things, and you can train, but then it hits and it becomes reality. And training doesn't always translate as well to reality as you would like, but thank goodness we do it. So we had the infrastructure in place to respond. It's pretty rare that we're 6 months into one response, and we've been doing this. We started in monitoring travelers in late January, early February, and then of course we had our first case March 6th. So really since February, I've done very little except for COVID, and so we can practice, we can train, we can plan, but it's hard to sustain this kind of effort over this length of time. And I know the healthcare system, you hear every night how nurses and physicians are so tired and so weary. And in public health, we're kind of the same way, where we have staff who have been amazing, that have put forth true heroic efforts to mitigate this virus, to stop the source of spread, and to take care of people that need to be taken care of. And I think no one expects a infectious disease response to last more than really a few weeks. It's been 6 months. So they're weary, they're tired, but they're dedicated, they're passionate, and it fills your heart up to see them come every day and give their best for the citizens of Tulsa.
Here in Tulsa, however, it's new since the reopening, is a younger cohort, a younger demographic of people both getting sick, getting infected with the virus, and also coming into the hospital.
not being hospitalized as much, but being carriers unknowingly in a lot of cases. I'm glad they're asymptomatic, but the bad side of that is they're probably spreading virus without knowing it and carrying it to the more vulnerable population. You know, there's something to be said that it certainly looks like the more vulnerable population is taken care of, and they are sheltering in place more. They're still following more of those rules. So anecdotally, I think we can see that and hopefully say that in what we're doing.
And this is another question that we appropriately get asked a lot, which is COVID different from the flu? Or why is COVID different from the flu? And we'll share with you some of the reasons why. And one of the reasons why that Dr. Stevens just touched on is when you have the flu, you are sick. You usually aren't asymptomatic. You're sick. There's no coming to school. There's no coming to work. If I'm a doctor, I'm not likely to go and take care of patients and interact with my colleagues because I'm symptomatic and I'm sick. What about the flu person or the flu patient, however, that is not that sick? There are some other differences. And two of the other differences that are big are we have medicines, proven medicines to treat the flu, number one, antivirals that treat the flu. And number two, we have something that's in the news all the time now, and we're going to hear more about it in the next year, and that's vaccines. So we have vaccinations for the flu. I hope a spinoff, another positive crimson lining of COVID, and all of the press that we're hearing about a vaccine for COVID. I hope what doesn't get lost in translation is how important other vaccinations are, whether it's flu vaccines or the vaccines we give our kids. These are unbelievably helpful in keeping our communities healthy. So I just wanted to touch on that point about flu versus COVID and how the flu is different, but how it still teaches us things about how we can better take care of ourselves.
I think everyone needs to understand that they do have a role in this response, and their role is to put a mask on when they're out in public, to be as physically distanced as you possibly can in public, and pay close attention to hygiene, hand washing, sanitation. And you know, if we all embrace our own individual responsibility in this pandemic, then we can work together and collectively and unilaterally start to flatten the curve on this virus. But we have to do it together. I know that for whatever reason, this pandemic has become very political. You know, the virus does not care about your politics. All this virus cares about is, can I go from person to person to person to person? And if we come together with one goal of overcoming this virus and stomping it into the ground, and we all do the same things, then we can beat this thing back. We can get back to normal much quicker than we possibly thought, and we can keep people safe until we have a vaccine and clinical therapy. So let's unite. Instead of fighting about this, let's unite around this. Let's embrace these recommendations. Let's do the right thing to protect others, and let's just continue to be kind and considerate to our fellow Tulsans and Tulsa County residents.
Doctors, thank you so much for that information. We know it has been a difficult time in Tulsa and globally over the last several months. Still, we are interested in the positives as well. So we'd like to know why everybody loves Tulsa.
I'm not from Oklahoma. I'm from a little state called Iowa. And my journey went from Iowa to Illinois to Oklahoma. And before I came to Tulsa, I knew a little bit about the city, but not much. And so like most of America and maybe most of the world, they don't love Tulsa because they don't know all the things that we have here. And you and I, all three have heard this described as Tulsa is sometimes talked about as the country's best kept secret.
It's what you see right behind you that everybody comes together. You know, I've thought about this a number of times, and we recruit a lot of you know, highly skilled people that are wanted across the entire United States and world. And if we can get them to Tulsa, they come because they see it. It's palpable as soon as you get off the airplane. It's in our campus. It's It's when they're in the hotel. It's when they're out to dinner and just walking through the gathering place. It's the community and just everything that's there. It's a caring community. It's a collaborative community. We've seen it with COVID. I mean, I don't want to bring everything back to COVID, but Dr. Aran and I, that seems to be all we live as most everybody else too. But, in middle March, all the community coming together and saying, hey, we've got face masks. We have this. We'll bring meals to the hospital. We'll do. It's that community that is just incredible.
Tulsa has a unique flavor and vibe to it that, I was military brat. I grew up all over the world. I've lived all over this country, and Tulsa has a friendliness and a uniqueness, and there's, regardless of where you come from, there's a place for everybody in Tulsa, which is not the same for every community that I've been in, and Tulsa just is very welcoming and inviting, and as soon as I got here, it felt like home, and that for me that says quite a bit.
I hope this is one of the common sense aspects of Tulsa, that when push comes to shove, we'll do what's right for our kids and families and citizens.
Thank you to Kristi Eaton and to all of our guests, and thank you for watching. I hope you'll join me again for the next episode of Tulsa Talks.